Said, like you all said, we're going to build a better healthcare system.
Yep.
Without taking out a sheet of clean white paper, how in the world would you build a better healthcare system?
A couple of things, and a couple of these things you haven't heard. First of all, I think we need a better public health system. At the end of the Second World War, America's public health system was the best in the world, and we largely dismantled that over time. Believing that someday everyone would have health insurance or access to health insurance. Well, that day hasn't come yet, and yet we took apart a public health system. So when I was growing up and my mother was a public health nurse, the services that you could get very inexpensively, provided on a community-by-community basis, was far greater than what they are today. Part of what we have to do in Connecticut, we have to do by reinvigorating public health. Another part of what we have to do, we have parts of the state where there are insufficient clinics, doctors, nurse practitioners. We may have to become the employer of last resort to make sure that there's equal distribution of medical opportunity. And by the way, we can do that in a very cost-effective way. We've proven we can do it. We do it that way. And you're going to say, well, how do you pay for it? Well, first of all, we've got to get people out of emergency rooms. When I last ran for governor, the average emergency room visit was $750. It's now in excess of $1,100. We have too many people getting their primary health care at emergency rooms. That's got to stop. We've got to be equally invested in keeping people healthy. You know, there's a very interesting report. Fred Carstensen, who was an economist, economic analyst at UConn, has pointed out that higher health care costs are actually a predictor of a stronger, more efficient workforce. The more you pay to keep people healthy or get them healthy, the better your workforce is. We don't tend to think about that in those terms. So making sure that everyone has an opportunity to be healthy, that everyone has the opportunity to get care as soon as possible in their illness, will actually drive down cost and make us more efficient. My public health ideas are being tried right now in San Francisco by a friend of mine, Gavin Newsom, who's the mayor out in San Francisco, who's banded the hospitals, the state agencies, the public clinics, the federally funded clinics, and the city health department to make sure that every person has access to health care. So these are strong ideas that we need to deploy and follow through in Connecticut. I'm very passionate about health care. I mean, there are things that we're working on. This pooling bill, which passed last year and the governor vetoed, will pass again this year. Hopefully the governor, if she vetoes it, will be overridden, is also an important start. We have many small businesses and many individuals who could buy their health coverage much more cost effectively through a state-managed health pool, and I'm a big believer in that as well. I think there are so many good ideas, but there's a lack of movement in this state. Listen, let's be very clear. What this governor did last year was to veto a pooling bill, stand in the way of creating universal health care in Connecticut, and then created something called Charter Oak, which she called insurance, which she was made to drop the term insurance because it's not insurance, and by the way, is insufficiently subscribed to by doctors and healthcare institutions to provide people with health care in the state. So we just simply have to make a major change at the top. But I'm just sharing some of the ideas.